Hello, I'm Dr. Rajyalakshmi. I'm 72 years old. I'm a retired professor of community medicine. I have worked in medical research, NIN Hyderabad, and retired. Now, 3 months ago, I fell down in the bathroom and fractured my left forearm in the middle with both bones fractured, both ulna and radius were fractured. So immediately my son took me to a nearby hospital. They took the initial x-ray and found that both the bones are fractured, and they put a temporary splint. My son did. He contacted who was known to us. He told us to come. So I got admitted, and he saw me. Then he said that he will do the internal fixation with plates, titanium plates and all. Then since he could not do it immediately, on the third day they took me to the operation theatre. But as I am already having some heart problem, I am having aortic stenosis with mitral regurgitation and also pericardial calcification in my heart. So the anesthetist came for assessment, and he refused. There were two anesthetists, and both of them refused to give any anesthesia. They said, then the cardiologist also came, and he refused to give cardiology clearance. He said she is under great risk. It is almost 90% risk. If you give even subclavian block, she will die. I mean, in the sense, there is a lot of risk. So doctor got very scared, and he said he's very, because they told him it is his responsibility if at all he takes up my case, and he refused. Then what he told me is that he will just to treat me according to the olden days procedure, like this closed reduction, traction and reduction, and then putting the plaster of Paris cast and keeping it for immobilization, keeping it in immobilization for 2 months or something. Then he told me because of my age it will take almost 3 months to heal and all. So anyway, he said he will review me after 1 month. So this happened on August 31st. Then I was discharged from the hospital, and for 1 month I was wearing the cast, and at the end of 1 month, when we went on September 28th and took the x-ray, there was no union at all. There was a small union with the radial bone, not with ulna bone, and the pain was also very severe. And what doctor said, you have to continue for another 1 month, and there was osteoporosis. So I started my calcium supplementations with the Calmag vitamin D, and then I also started taking bone health capsules, so that my bone minerals will be improved. So this happened for another 1 month, and at the end of 1 month, when I went back again to a hospital, again they took x-ray, and it was the same. There was no change at all. So what happened, I mean, he just put a posterior slab and then sent me away. He said, you just do whatever you like. Then I immediately thought that I must go to another hospital. I was very, very very apprehensive. I didn't like the attitude of the doctor at all. Then I was searching for a good orthopedic surgeon and a good hospital. Then I remembered that one of my friends who was in Hyderabad at that time, she had a fall in Singapore and broke her kneecap, and she was operated in Kim's hospital under one orthopedic surgeon. I didn't know who he was that time, and she recovered very well. In fact, she is now walking very nicely now. Even within 2 weeks, she started walking. And she also told me that the doctor was very good, and her son said he is the best orthopedic surgeon. At that time, it didn't occur to me to even ask the name of the doctor. So now I tried to, very frantically, I tried to contact her, and then that also took almost 2 weeks to contact her, and got the name of Dr. Uday Krishna Myneni. Then she told me that you go to him, he will do it definitely. So when I came to see doctor, I took an appointment, and it took some time, because our own problem, we could not go to the hospital. 1 week, another 1 week wasted. But still, when I went to see Dr. Uday Krishna, he was very confident. He told me, don't worry, I will definitely do it under subclavian block for you. We won't give you general anesthesia and all. He listened to all my problems very patiently, and he was, that assurance he gave me, that actually, I told him, I lost all the hope. I thought I'm going to lose my hand. I thought I'm going to get amputated. Then he said, no, don't worry at all. Then when I went to the operation theater, actually, when they give the pre-op, something like pentothal sodium drug, immediately I went to sleep. I didn't know what happened, and it was so nice. I got up only when they were finishing the operation. No pain, nothing. And when they shifted me to the ward also, it was really very nice. I really felt very happy. And what happened, after 4 hours, I started getting the sensation and all, and everything went off very well. I'm so happy that I came to this hospital, and I also find this hospital very, very nicely maintained, and there is lot of personal aspect. The way they, when I gave the email to them, the way they started contacting me and then reminding me for my appointment, it was really, I was so surprised, because no other hospital, because we only have to call them 100 times. But here, they were calling me, they were reminding me, especially Mr. Naushad, Dr. Secretary. He used to call me, Madam, I am reminding you about your appointment. And this never happens in any other hospital. This personal interest, I really appreciate. I'm very happy, and I'm very, very thankful to Dr. Uday Krishna. He has given me back a new life. I told him, you are like a god to me. And then Dr. Reddy, anesthetist, and then Dr. Rajyalakshmi, anesthetist, all of them, and the team of Dr. Uday Krishna, they are all very nice. Dr. and Mr. Naushad and all his people, and even in the ward also, the operation theatre, everywhere. So I am really happy, and I want everybody to, even I am thinking of putting it in docs places. That is our doctors network, I want to put the whole thing in there, and then show that how a doctor, especially the orthopedic surgeon, can bring hope and life back to a very, very desperate patient. Thank you all.